I am at St. Barnabas Hospital in the Bronx, New York.
I work as a resident physician.
I am an emergency room physician.
This is, I believe, getting rapidly worse. So I think, for physicians all over the world, it feels like we see, we're like at the beginning of a horror movie and we're trying to tell people what's coming.
I worry about my colleagues. I worry about my family. I worry about, everybody. It's like, this is bigger than any one person. And as a society, I think we need to do a much better job of keeping everyone safe.
I'm worried about my coworkers. I'm 50-year-old. I have coworkers who are older than I am and may have some other health conditions, and I'm worried about their health. I'm worried about the status of healthcare in the country.
Right now, it's almost like we're holding our breath because we're in a situation where right now we have PPE, we have hospital rooms available, we have ventilators available, and it's almost like you don't want to exhale yet because we know that there is more to come.
Right now, it seems like we have enough now, but given the sort of the current burn rate for personal protective equipment and other important supplies related to the problems that occur with this disease, I fear, my greatest fear is basically running into shortages of important things. Personal protective equipment, I think, is one of the most important things, because if we as sort of the frontline providers are unable to protect ourselves and we get sick and go out, then there's no one else that's going to be able to care for the people that are coming in. And we're doing things that normally we wouldn't do. So we're reusing things like N95 masks. We're reusing different kinds of face shields and goggles and decontaminating them between use and storing them. And they're really not designed to do that. But at the same time, it's better than not having anything at all.
The hospital has its own stockpiles, and we're trying to use it judiciously, because you can go through the whole stockpile of a hospital in this setting in less than a week.
In the back of my mind, and the sort of the things that sort of play out is, what happens when we run out of ventilators? What happens if I start to have to, make decisions about who gets a ventilator and who doesn't? We're already circulating through a number of different venues, sort of ethical considerations and ways of approaching this mass casualty incident that's unfolding before our eyes.
A lot of people with power in this country didn't take it seriously early on. I hope that doesn't come back to harm us more than, that's concerning of how we didn't take it seriously, of how we saw reports of systems being overwhelmed in other parts of the world. And I don't know if there's a perception of that it couldn't happen in the United States, or if there was just the hope that it wouldn't happen.
Most people that go into healthcare do it because they want to help people. And I think right now, the stress that healthcare providers are facing is kind of multifaceted.
I think I've noticed more symptoms of anxiety this past week. I think it's also been palliated by a wonderful group of humans that I get to work with, of fellow resident physicians that we would do anything for, and nursing staff and care coordination staff that there is a sense of one giant team working together as we navigate this space that is new territory.
I don't know how exactly to say this, but I don't think I've ever been prouder to do what I do, and of all the people that I work with.
This isn't a sprint. This is going to be a marathon.
At the end of the day, I wish I had more time to process. So I'm actually kind of grateful we could chat, because this is very therapeutic to kind of